Hello everyone, I am Dipesh Limbu. I'm currently working as Senior Program Officer at Visible Impact. Visible Impact is a young women-led organization that have been working in the field of sexual and reproductive health and rights, youth and women empowerment since the establishment of the organization. Thank you. So, as I mentioned earlier also, uh, Visible Impact has been working with youth, women, and adolescents in the field of sexual and reproductive health and rights. Our theory of change is when innovative approach is multiplied by beneficiaries engagement, then we see a visible impact in the community. And we try to engage our beneficiaries in our program and try to conduct those programs. So we have a championship model that we normally apply in our activities. So that is like we train young people as a youth champion. So there are volunteers that work at the grassroots level in order to aware people regarding the issues that we have been working with or we are advocating for. And also they are our representative in the provincial or the local level to represent and to advocate for the issues with provincial and local government in our uh, capacities. So when we talk about social norms associated with sexual and reproductive health and rights, the prevalent stigma or the concept that SRH is a taboo to discuss in community uh, has to be the topmost thing that we have to discuss, because sexual and reproductive health and rights is a vague term and it includes a lot of things from menstruation, family planning, contraception, sexuality, and safe abortion, gender-based violence. So these all topics are very sensitive in our community, and whenever we talk about these issues, the prevalence myth or the stigma always comes associated with these issues. So when we specifically talk about, or when we are working with menstruations, we hear different myths and informations regarding menstruation. One of the major thing in our community is that menstruating persons are impure and they are restricted by entering to the temple or performing religious activities, and even they're restricted to enter kitchen in their homes. When we talk about menstruation in rural areas, specifically the far west side of the country, there is a problem. There's a process in community that menstruating people have to stay outside the home at specifically designed room that is called chow goat, or and the system is called chow buddy. So chow goat are not hygienically maintained, and it is not sanitized properly. Hence, the menstruating people have might be exposed to different kind of infections, and different kind of incident has also been reported in those cases, like the cases of rape or snake bite has also been reported while people staying in Chowgoat. So or the other concept in our society regarding menstruation is that menstruating people should not touch flower. If they do so, the flower will die out. Menstruating people should not touch any certain kind of foods, because that would decay the food early. So this kind of misinformations or myth associated with the menstruation is prevalent in our community. When we talk about SRHR, people always associate it with sexual relationship or or the sexual intercourse, but it is not just sexual intercourse or sexual relationship. It is also about contraception. It is also about gender-based violence. So when we are advocating for contraceptions, people always associate that sexual activities is just for married couple, but not for unmarried individuals, and unmarried people should not engage sexually. But then there are a lot of statistics, a lot of cases where people before the marriage are being involved with are like sexually active, and limiting the contraceptive access to person to married couple only arises the risk of sexually transmitted infections or early and teenage pregnancy, unwanted pregnancy among unmarried individuals. So the access to contraception also should be ensured. So while we are talking about SRH, we also need to mention safe abortion. So safe abortion is very sensitive topic in our community, and there are people are divided when we talk about safe abortion, because there are certain groups of individuals who are against safe abortion services, and there are certain group of individuals who are supporting safe abortion. But people should be aware that safe abortion is not a negative thing, or not a thing that will affect the health, but safe abortion services is a choice given to pregnant person in order to maintain their health, in order to maintain their mental and physical health as well. Because most of the cases that we see in our community, and there are a lot of cases of maternal mortality because of onset abortion. And in order to reduce those onset abortion related death in our community, we are emphasizing the availability of safe abortion in our community. Also, like when we talk about sexuality, our society normally perceives that sex and gender is just male or female, the binary notion of sex and gender. They're not ready to accept the concept of sexual and gender minorities, and they're not ready to respect the person from this community to be integrated within the community. They feel like they need to be changed, or they need to come back to being normal, uh, the box of being male or female. But sex or gender identities is beyond binary, and that has to be represented well in our community and has to be respected well in our community. The other social norms regarding SRHI is that whenever we talk about persons with disability and their sexual and reproductive health and rights. There are some studies that have mentioned that healthcare providers have denied services of family planning or contraception to persons with disability because they think that persons with disabilities are not sexually active, and they do not or they should not bear any children because they will not be able to take care of those children. But these kind of preconceived notion drastically impacts the reproductive health, sexual health of persons with disabilities, and they need to have an access to the services that they require respectfully, inclusively. The other norms when we talk about SHI is, or like when we associate it with the gender norms, the preference of male child in our community, that is also one of the major challenges that we need to tackle on, because that not only give rise to gender inequality, but also reduces an opportunity and increases disparity in knowledge and accessing reproductive health and services to persons in their diversities. Yeah, thank you. In order to shift the prevalent social norms, we and our youth champion has been working in different levels. So our youth champion mostly work at grassroots level, whereas we as an organization are working from federal level to the grassroots level itself. Talking specifically about the activities that our youth champion have been conducting at the grassroots is awareing people regarding the sensitive issues and busting the myth associated with menstruation, safe abortion, or adolescents contraceptions or youth contraceptions uses. They have been, reaching out their peers, adolescents and young people from the community, awareing them about these issues. Also, they have been reaching out to the local community leaders, the parents group, and informing them that their child needs SIHI services and it has to be prioritized, so that they could also help in providing the services to their children. Beside that, also, our youth champion has been actively advocating and working in close collaborations with the provincial government so that they have the support from the government entities as well in their advocacy journey. They have been trying to influence the policy at the local level. They have been, jointly working with local governments so that the SRH services is easily and affordably accessible and accessible to persons in their diversities. So that is how our youth champion has been working. If you talk about how Visible Impact as an organization is working, we work with different stakeholders from national to the local level. We work with the like-minded organization so that we could, collectively have an say to the to issues and have a collective effort in shifting the norms. Beside that, we have been working with the federal government closely in terms of policy implementations and in terms of policy changes that specifically highlights the need of young people, persons with disabilities, sexual gender minorities. We also have been working in close collaborations with the healthcare providers of from the local level. We are value clarifying and sensitizing them regarding the needs of persons in their diversities, and have been informing them that they should be able to provide a respectable services to any clients, regardless of their identities. Beside that, we have also been closely working with media professionals because one news or the one informations about the issues would circulate throughout the nations, and that might change the perspective of the readers. So we are grooming them on what kind of terminologies or languages to use while writing news, what kind of images or pictures are appropriate to use to convey this kind of messages. In this way, we have been working with the local media or the national media as well. So this is how we've been working with different stakeholders throughout the country. When we talk about challenge, I always recall one incident during the initial phase of my, advocacy journey, when we used to approach any local government or someone from the higher authority positions. They would always be in shock looking at us. Like they would say that you're very young, you look like an adolescent. Will you be able to do this? Like, will you be able to perform? So that kind of trust issues is always associated with young people and adolescents whenever we are trying to work. So gaining, like over the period of time, we have been able to receive the trust and the support from these agencies because of the work that we have been doing and because of the result that we have been creating in our community. So uh, it's very difficult for those people to have a trust among young people and to believe them completely. So that is one of the major challenges that most of the adolescents and young people in our community or in our society face while trying to advocate for an issue that we believe in. The other challenges has to be the dropout case of our youth champions, obviously, because we do not work directly with the community people. Our youth champions are our local representative and who are working directly with the local government or local community. So when there are dropout cases of our trained volunteers, trained human resources and community, it definitely affects the result or the goal that we're trying to achieve. Plus, our commitments are year-long commitments for our youth champions. So sometimes they might get involved with the personal personal choices, or because of the education academic background also they might not be able to continue for a long time. So dropout cases are one of the challenges that we have seen in most of our activities. In order to overcome this challenge, we clearly inform our youth champions before the selection process that it is a year-long or certain time-long project, and they need to give their commitment. But then, like when there are dropout cases, we try to rehire and retrain young people, but we try to have on board a youth champion that has previously worked with us were already trained, we're already sensitized, and we're already aware, so that we don't have to spend more resources on trainings and all. So that is how we're trying to overcome these challenges. Uh, the next challenge is, I think, since like Nepal has already gone into federalism, and the power and the roles has been shifted from central government to the local government or the provincial government. And the constitution has clearly stated that the roles of central or the local government is this and that, but there are still dilemma, and the local government is still unclear about implementing those regulations, implementing their roles and responsibilities within their community. That makes challenging for not just for us, but for our youth champion also, in order to advocate and perform without the support of local government. To give you an example, when we talk about, say, abortion regulations, there are act and guidelines at a national level, but most of the policymakers or the the local government are not very aware about implementing those regulations, and they do not have proper localized guidelines in order to implement the act in the area. And whenever we reach out to them regarding these issues, they would be always saying that, you are the first one to come up with these issues, or we have never thought about these issues. So unsensitized local government, or an unclear role division within the local government is one of the major challenges that we face while we work in grassroots level or the provincial level. One thing that I've learned or that I've reflected through my work is the role or the importance of peer education. Since our youth champions have been conducting different peer educations, and the result has been very influencing for us, or also very appraising the work that the youth champion have been doing through peer educations. They have been able to transform the attitude. They have been able to aware peers in their community regarding the sensitive issues that we have been working with. Uh, and these aware champions are more inclined towards advocating for inclusive community, for stigma-free society, and they have been always inquiring about being engaged in long term with our organization as well, and to be a change maker in the community. So the peer education has been able to shift that norms among young individuals, and have been able to recruit them as a change maker or inspire them to be a change maker in community. So that is one of the major learning throughout this journey that I have been working with. The another learning is that engaging with healthcare providers and providing them value clarification and attitude transformation, because this VCAT training has been able to transform the concept, has been able to transform attitude and increase knowledge about the importance of safe abortion, the importance of sexual and reproductive health and rights for persons in for persons in diversities. And in our training, we try to bring guest speakers from representing communities. For example, if we are talking about persons with disabilities and their SRHR, we have a guest speaker from persons with disability community. If we are talking about SRHR services for sexual and gender minorities, we have a representative from sexual and gender minorities community who come forward, who discuss about their challenges that they face while trying to access the health services in their local health institutions. They talk about the needs or the different need of different individuals, and they also suggest our health care providers how they can provide the services in a dignified manner, in a respectable manner. That has this kind of training has helped our healthcare providers to rethink about how they are being treating their patients, how they are providing services to persons in persons with disability or sexual and gender minorities, or even like adolescents and young populations. And I believe that value clarification and attitude transformation is not just important in terms of value clarifying healthcare providers, it was also very important to replicate among different other stakeholders like policymakers, local government, or even parents or teachers in our community, so that every individual in our community are aware and sensitized about the importance of SRHR for all persons, regardless of their identity. Um, so this is also like one of the learning that we have had. The other learning I would have to say is that, while being in a different advocacy spaces internationally or locally also, we always talk that our Nepal's policy and legislation is very progressive, and it is very liberal in South Asia, but that is just in policy, that is just in paper. While we try to reflect it in our society, in our grassroots level, this scenario is totally different. So I think what I'm trying to emphasize with this learning is that it is very important to have a collective agency or the collective effort in trying to shift the norms, not just within the community, but also making accountable to our government for the policies that they have created. And it is very important for us to make them accountable and make a federal, local, and provincial government to implement those policies so that persons in diversities have access to affordable and accessible healthcare services, specifically focusing on sexual and reproductive health. So these are the learning that we have had throughout the project.